I'm Don Phipps, Superintendent of the Caldwell County Schools, and I'll be your host today for Caldwell County Schools Profiles. Today's show we have two special guests with us. We'll begin with Mr. Guy Garner, the Director of Child Nutrition Services with the Caldwell County Schools, and he'll be talking with us about the feeding program. And then we'll have Dr. Bill Griffin, Assistant Superintendent for Human Resources, who will talk about our move and transition to Plan A. And we'll get started with Mr. Garner. Guy, thank you for being here.
Well, thank you for having me.
How long have you been in the child nutrition business with the school system?
With the total school system, about 32 years.
And in a normal year for our operations, I think it would be interesting for viewers to hear what do we do in terms of meal preparation and serving meals in terms of numbers per year?
We do about 1,300,000 lunches and a little over 700,000 breakfasts.
So that's a major operation.
Yes, sir.
And we know that there's a program with the federal lunch program where students are able to get free and reduced lunch. In a normal year, how does a student or family qualify for receiving those services?
Well, we have it where they can apply multiple ways. We have one that we do what we call direct certification, where we get a list from DSS. We also have an online portal that they can go in and apply, or they can get a paper application and fill it out. And that qualifies them for the whole year. And at any time during the year, if their finances change, they can fill out another application.
And how did that change in March of this past year?
Just like everybody, it's kind of gone crazy. But we are now operating under what they call the summer feeding program, where everybody gets to eat for free without filling out an application. So if your child is hungry, have them come by and they can have breakfast or lunch for free.
So if they've been a paying student while this is in effect, they would be able to eat for free, correct?
Yes, sir.
Okay. And how long will that be in effect?
It's supposed to be until the end of this physical school year.
So, okay. In the end of December?
End of the year.
At the end of the school year. Okay.
June.
Very good.
Mm-hmm.
All
They've
right.
just passed that.
Okay. And these things are changing. It seems like every week we have a little bit more news and information. We certainly are glad that we've got a way to support our children and families. Tell us a little bit about what we have in place right now. I know we did some, and talk to us as well, because I think it's a tip of the hat to you and to the child nutrition staff for what you did over the summer. When we talk about the summer feeding program and the meals that were provided from March until we started back, give our viewers just an idea of how many of those were served.
Well, we served a little over 1 million meals from March till end of August. And basically what we did is we passed out meal packets for a family or per child that they could eat 10 meals, 5 breakfasts and 5 lunches per week. Now we are also doing that for students. They can come by and pick up on Wednesdays at our 4 locations, Gamewell, Granite, Davenport, and Hudson Elementary. And from 11 to 1 and 4 to 6, they can come by and pick up a 10 meal packet. And any child can get it. At the end of this month, whenever we go back and all the kids are going to elementary and A, then the elementary kids will not be able to get that anymore at the end of this month. Starting in November, it'll just be for middle and high school students.
When we get back on the 19th of October, will a child be able to eat for free in school?
Yes,
Okay.
That will continue all the way to the end of the school year.
And I want to go back over the pickup sites again, just so our viewers are aware that its pickup days are on Wednesdays.
Wednesday?
The times 11 till 1 and 4 to 6.
Yes, sir.
And the locations are?
Granite Falls Elementary, Hudson Elementary, Gamewell Elementary, and Davenport Elementary.
Okay. And this is for any person in Caldwell County 18 years and younger. So it's birth to 18. They don't have to be a student of ours, and we encourage them to come and get this food, correct?
Yes, sir. One misconception is just because they ask you for your child's name, all that is just putting them on a list that we have to have for the federal government, but it's not used for anything.
Okay. So we talked about that, having that in place. There's a new USDA program. Can you tell our viewers a little about it?
It's called Farmers to Families, and what it is a box of 32 pounds or a little bit more of milk, produce, and protein items like chicken or cheese, yogurt, that kind of stuff in the box. and apples and potatoes and butternut squash and all kinds of things that are grown here in America, and it is in a box that we give along with the meals that we're passing out.
And how would a person go about getting one of those?
Again, they go to the 4 pickup sites, 11 to 1 and 4 to 6 on Wednesdays, and we will have that with our meals that we're passing out for kids.
Is this limited strictly to students or children in our county?
No, sir. Anybody can go by and pick it up, and and it's as long as we have them, because we only get a certain number each week.
Right. So there's no eligibility in terms of age or income, but the problem that we're running into is that we're just running out of supply.
Yeah.
Right. So this is an effort for us to get the word out. Anything else you would like to share with our viewers from the child nutrition world?
No, it's just we're here for the kids, and make sure we have a lot of people working hard to try to make sure we get the kids taken care of in a safe manner. We are serving meals a little bit differently in that we're putting them in a box lunch box and giving it to the child. So it is a very safe and sanitary situation, and they get to also choose what the items they want. So we feel like the kids should be very happy.
So if you're doing 5 meals at one time, are those frozen meals that are going home
Yes,
with
those
kids?
are frozen meals that we send home.
And I know they're greatly appreciated. I can't tell you how much we appreciate your leadership and the work of the folks in child nutrition. They don't get the praise and attention that they deserve, but they have been true heroes in this time. So thank you so much.
Thank you.
We appreciate you being here with me today. Thank you for being with us. We hope that you'll stick around. Our next segment will have Dr. Bill Griffin, Assistant Superintendent of Human Resources for the Caldwell County Schools. Please come back and join us. Welcome back to this edition of Profiles. I have with me here on the set Dr. Bill Griffin. Dr. Griffin is the Assistant Superintendent for Human Resources with the Caldwell County Schools. Dr. Griffin, thank you for being here.
Thank you for allowing me to be here today.
There's so many things that we could talk about, and HR touches so many areas, and I know you work closely with Human Resources work that goes into curriculum or facilities or the pieces with finance and that kind of thing. But I really want to talk today about Plan A and the transitioning, but can we take our viewers back to the summertime? And the governor gave us kind of a mandate to develop 3 different plans, and one of those was a normal plan, which was Plan A. Plan B was basically 50% of students back or able to socially distance, and then Plan C was the remote learning plan, and we had to have those 3 plans in place, and we're waiting for his decision on what to do. Walk our viewers through what that process is like. Number one, we've got a lot of options and we don't know which one we're going with, but who's involved in that process? What kind of data are we collecting, that type thing?
Sure. First, I'd like to begin by saying thank you for your leadership during this time of need. Also, all of our other departments here at the Education Center, as well as our school board, our public officials, certainly those from the health department, Anna Martin and her crew. It's certainly been a team effort. I really reflect back to March, and when we went out of school for the first time for what we were learning about coronavirus. Our knowledge was certainly very minimal at that time. We didn't know that we would even be out of school for more than a week or so. And at that time, we were planning for a week, which turned into 2 weeks, and then several months to where we did not return with students, which led into the summer. And during the summertime, we were anticipating a decision made by the governor or our officials to give us some guidance and direction on what we were going to do as we return to school here in August. We didn't receive that really until July. We were to put together 3 plans, but at that time we really didn't have the knowledge base of what we were working on. So we did develop 3 plans and 3 ideas of how we would move forth. C being that everybody was in all remote. B, kind of a hybrid approach, which we started the school year out, and then A, where we would come back with that of recommendations by our health officials and CDC to face-to-face instruction. So once we were given the order by the governor in July, we began frantically really to put together what was best interest for us. I would like to say hats off to our curriculum department for putting together basically that of a master schedule for our whole district. So we began working to get our employees back. We had to survey our employees, We had to survey our parents. We had to survey our students, find out what their needs were, what their interests were, what their feelings were at that point. Because even today, we have so many people that feel differently about this virus than others. So we looked at that data, made a decision. Our board made a very, very difficult decision, and that was at that time moving to Plan B, which involved really about 3/4 of our students returning face-to-face, a little over 8,000 students returning face-to-face instruction. And then we gave that option for those that didn't feel comfortable at that time, and that was our Caldwell Connect option that we had. But so we determined master schedule for face-to-face and that hybrid AABB day. And then we also had that of online learning through our Caldwell Connect and working with those employees. So a very intricate process that took a lot of people and a lot of thought behind it.
And I think back to those days in early August, and we couldn't make the decision to ask questions of parents until we knew what the governor was going to tell us we were able to do. And having been a principal like you have, we know the importance of that master schedule. And our principals really didn't know who was going to be in the building, in some cases until Friday or Saturday, the weekend before school started. So it was trying in many ways. So we fast forward and we get through that, and we've been in school. The governor makes another announcement on September the 17th that gives school districts the opportunity to go to Plan A if they wish to, no earlier than October the 5th. So where are we at with that now?
We had decided when we started Plan B that for our elementary school students in K-5, and that's who this new proclamation goes towards, is our elementary K-5 students, and allowing them to return full-time face-to-face if they so desire. We had already put in place transitional points at the end of the 9 weeks because we know people's feelings change, people's thoughts change, and we had the foresight to thinking forward enough to allow those folks that were feeling a little more comfortable, that if they were in an online platform, that they could transition back to that of a face-to-face. So we had multiple students already that were coming back to us, and then as the governor announced it, giving us the ability to go full face-to-face. So once again, we had to ask and poll our parents. We had to talk to our employees and making sure that we had enough people to staff those students, and then we had to figure out, well, who's coming and who's staying. And we've had the majority of our folks that are coming back to face-to-face learning. We also have some that the 5 days they don't feel comfortable in that, and all the students being there. So we've had a few students actually move back into the Caldwell Connect or full-time online learning as well. So we've been working with our principals and each of our school leaders to determine a new master schedule for the 9 weeks and those changes so that we can serve these students properly. And again, a lot of work and a lot of time and a lot of thought into doing that.
And for our plan, when we began the initial part at the beginning of the year, we had kindergartners and first graders back on campus 4 days a week. Pre-K have been here 5 days a week. This new plan only impacts kindergarten through 5th grade. What implications does this have for the HR department?
For us in human resources, in dealing with all of our personnel, we began an interactive process with our adults to begin with. We had to answer the question, number one, who is going to be our workforce? And with this virus and the unknowns and not knowing everything there is to know about it, and we still don't, and I'm not sure when we will. But we have people that are very cautious on that. We have those that are deemed high risk. We have some with health issues. We have some that have family members that have health issues, and are frightened to take that into their home. That would be detrimental to anyone. So we had to look at safety being number one, but we also have to keep in mind that we have to serve now over 8,000 students face to face. So we've got jobs and duties to do. So we had to really work hard to figure out a way to find a happy medium and a happy balance for all of those. So we have spoken with our employees. We now have leaves going on. Unfortunately, it's seeming that everything that's related to a coronavirus and symptoms of coronavirus mimics that of the common flu that we know, also the common cold that we know. So we're having to really listen and get the guidance of our health officials to make sure we keep a safe work environment, a safe place for our students to learn. So that requires us to contact, trace individuals in our buildings, and make sure that we can keep a safe place to work and learn each and every day. And that certainly goes into HR on a daily basis.
Well, you mentioned the use of surveys a couple of times, and I know we're interested in stakeholder feedback. How has that played a role in the decisions that ultimately were made by the board?
I think all of our decisions are data-driven. We all have our personal feelings. Each person is entitled to those. But when you're operating and making decisions based on students and safety of our students and our personnel, I think you have to look at the data. And our board has done an outstanding job of that. We've put out avenues to try to collect and survey and ask questions of our stakeholders and our parents, our students, our community, and making sure that we're doing what we believe to be the best thing in the best interest of our students. Face-to-face instruction is great for some. Online instruction is great for some. We're trying to find out what's the best avenue of learning for our students, because we've got a lot of ground to make up. I guess leaving in March left us with a deficit and some gaps that we know we have there. So we've got a lot of ground to make up and a lot of catching up to do, but we have to do it in a safe fashion as well. So our board's done a great job of looking at that data and trying to take the feedback of our constituents.
Explain to our viewers about class size mandates and how that has an impact on how large a class could ultimately get.
Sure. So we're operating currently under now, which would be House Bill 90 that was passed several years ago, that basically says that our K-3 class size, we have guidelines that we have to adhere to. This year we can have no more than 18 district-wide average, and no more than a 21 individual class size, so at 18 to 21 parameters on those class size. And we have to adhere to those mandates. That's a law that we have to follow. So not only are we housing students, but they don't come to us in what I call a perfect box. They don't come to us in a perfect 18 or a perfect 21. They come to us in 2s and 3s and 4s and 5s and sometimes in 20s. And then we have to divide them and adhere to those laws and regulations. So every time we get a different student in, or we have a different student change over from Caldwell Connect or to that of face-to-face, it requires us to make changes. We've had a lot of changes and adapted a lot, and I'm certainly proud of our teachers being able to handle those changes and adapt as we've had to this year on the fly.
Well, those class size limits are going to help control the numbers in K-3 classes. 4th and 5th graders don't have those limits, so we know those class sizes can be larger. They're bigger students, they take up more area. We're concerned about social distancing. What are some of the safety protocols that will still be in place when students come back, just to allay fears and concerns that parents may have, to let them know of what we're going to continue that we have in place?
We will always follow the recommendations of our health officials. So, pending on the class size average, we're also we're meeting daily with our principals and making determinations that when we go to A as to how many students we're going to have in those classes. We're bringing teachers back from Caldwell Connect back into the face-to-face operations so that we can limit those numbers. So anywhere that we see that we're going to have a large number of students in a class, for instance, 4th and 5th, as you mentioned, we're having conversations with our principals on how can we utilize our teachers most effectively in a safe manner to reduce some of those class size numbers. So we will absolutely distance our students as much as we're feasibly possible. We'll continue to monitor and adhere to the guidelines that we're given. We'll continue to wash our hands and wear our face mask and make sure we have distance between ourselves as tolerable and allowable as we move forward. So those things won't go away, and I don't foresee those things going away for some time. I think we'll operate under those guidelines even after this pandemic's passed, just for the comfort and safety of our well-being of our students.
Temperatures will continue to be taken. We'll use our isolation rooms for symptomatic students and adults. We'll continue all of that. Thank you so much for your time today. One of the things that's interesting to me is what will be left over after this is finished. And I think there's some procedures and protocols that we have implemented and had part of what has become normal for us, and some of those will be carried over. But we are so grateful for our parents, our students, our staff members, members of our community for being patient and flexible as we work through a very difficult time. I want to thank Dr. Griffin for joining me for this segment. Thank you all for being a part of this and watching this episode. We look forward to having additional information and good news to share in our next episode. Thank you so much.